Adolf Hitler's health and the medical care he received during his years in power have been subjects of fascination and analysis for historians, medical professionals, and the general public for decades. Hitler suffered from numerous real and imagined ailments throughout his life, and particularly during the war years, his health deteriorated significantly, affecting his ability to lead and contributing to some of his increasingly erratic decision-making. The doctors who treated Hitler occupied positions of extraordinary access and influence, witnessing his physical and mental decline, prescribing treatments that ranged from conventional medicine to dangerous quackery, and in some cases enabling his drug dependencies and worsening his conditions. When Nazi Germany collapsed in May 1945, what happened to these physicians who had attended the Führer? Did they face prosecution for their roles in the regime? Were they held accountable for medical malpractice or for crimes beyond their clinical duties? How did they explain and justify their treatment of Hitler and their broader involvement with the Nazi regime? Today, we'll examine the fates of Hitler's principal physicians, focusing particularly on Dr. Theodor Morell, who was Hitler's primary doctor from 1936 until shortly before his death, but also covering Dr. Karl Brandt, Dr. Hans-Karl von Hasselbach, and others who treated Hitler at various points. This is a story about medical ethics and their violation, about how physicians can become enablers of dictators, about quackery and malpractice at the highest levels, and about accountability and its frequent absence in the chaotic aftermath of the Third Reich's collapse. Hitler's relationship with doctors and medicine was complex and reflected his personality and worldview in revealing ways. He was simultaneously hypochondriacal, constantly worrying about his health and convinced he suffered from various serious conditions, and also dismissive of conventional medical wisdom when it contradicted his own beliefs or desires. He consulted numerous physicians throughout his life, often playing them against each other and seeking out doctors who would tell him what he wanted to hear, rather than objective medical truth. He was attracted to unconventional treatments and alternative medicine, particularly approaches that claim to have special or secret knowledge that the medical establishment rejected. He was also deeply concerned about his image and his ability to function as Führer, which meant he demanded treatments that would keep him energetic and functional, regardless of whether those treatments were medically sound or healthy in the long term. These characteristics made Hitler vulnerable to medical charlatans and made his medical care increasingly problematic, particularly during the war years when his health issues multiplied and when the physician who gained his greatest confidence was a man of dubious competence and ethics. Dr. Theodor Morell was born in 1886 in a small town in Hesse, Germany. He studied medicine and established himself as a physician in Berlin, where he developed a practice that combined conventional medicine with various unconventional and proprietary treatments of his own devising. Morell was not a distinguished physician or researcher, but rather an opportunist who cultivated wealthy and influential patients and who was willing to provide whatever treatments patients desired. He became physician to several prominent figures in Berlin society, and through these connections, he was eventually recommended to Hitler in 1936. At that time, Hitler was suffering from stomach pains and digestive problems, conditions that had troubled him for years and that conventional physicians had not successfully resolved. Morell examined Hitler and confidently promised he could cure these problems through his treatments. He prescribed a regimen that included diet modifications and various medications and injections of his own formulation, and Hitler's symptoms did improve, whether due to Morell's treatments, to placebo effects, or simply to natural fluctuation of his conditions. This initial apparent success won Morell Hitler's confidence and began a relationship that would last until April 1945, just days before Hitler's suicide. Over nearly 9 years, Morell became Hitler's primary physician, seeing him almost daily, administering injections and medications, and exerting enormous influence over the Führer's medical care and overall health. Morell's treatments evolved and escalated over time, eventually including a bewildering array of medications, vitamin injections, hormone preparations, and various substances of questionable composition and safety. By the war years, Hitler was receiving multiple injections daily, taking numerous pills and medications, and was almost certainly dependent on various stimulants and other drugs that Morell was providing. The exact composition of many of Morell's preparations remains somewhat unclear because he kept poor records and because some of his proprietary compounds had secret formulas. But it is clear that Hitler was being given amphetamines or similar stimulants, various hormones, numerous vitamins and megadoses, preparations derived from animal organs, and many other substances. This pharmacological cocktail almost certainly contributed to Hitler's declining health, his mood swings, his tremors, and other physical symptoms, and possibly to his increasingly poor judgment and erratic behavior. Morell's position as Hitler's doctor gave him significant power and wealth. He received payments from Hitler and was able to use his position to enrich himself through various business arrangements, including pharmaceutical manufacturing. He became quite wealthy, living in luxury, and enjoying the privileges that came with being physician to the Führer. Other doctors around Hitler, including more conventionally trained and reputable physicians, were deeply concerned about Morell's treatments and tried at various times to challenge his influence or to expose him as a quack. However, Hitler trusted Morell absolutely, rejected criticism of him, and refused to consider changing physicians. This loyalty was partly because Morell told Hitler what he wanted to hear, portrayed his treatments as giving Hitler special energy and capability beyond what normal medicine could provide, and generally enabled Hitler's desires rather than imposing medical discipline. It was also because Hitler felt that Morell's treatments worked, that he felt better and more energetic when receiving them, even though this was likely due to the stimulants in the injections creating artificial energy, while the overall regimen was damaging his health. Dr. Karl Brandt was a very different figure from Morell. Brandt was a well-trained surgeon who became Hitler's escort physician in 1934, meaning he accompanied Hitler on travels and was available for emergency medical care. Brandt was a committed Nazi and SS officer who used his medical credentials and his access to Hitler to become deeply involved in the Nazi euthanasia program, and later in coordinating medical experiments on concentration camp prisoners. Unlike Morell, who was primarily concerned with treating Hitler and enriching himself, Brandt was an ideological Nazi who used his medical training in service of criminal policies. Brandt's relationship with Hitler was more distant than Morell's daily intimate involvement, but Brandt was present at important moments and was consulted on medical decisions. However, Brandt increasingly came into conflict with Morell over treatment approaches, and he was among those who tried to convince Hitler that Morell's treatments were harmful. These attempts failed, and actually resulted in Brandt losing favor with Hitler. In 1944, after a dispute involving Brandt's family being evacuated from Berlin without Hitler's explicit permission, Hitler dismissed Brandt from his position, and Brandt spent the final year of the war in relative disgrace, though he continued his involvement in medical war crimes through other channels. Dr. Hans-Karl von Hasselbach was another physician in Hitler's medical entourage, serving as one of his escort physicians alongside Brandt. Hasselbach was an SS officer and physician who was present at various times during the war years. Like Brandt, Hasselbach had concerns about Morell's treatments and joined in attempts to challenge Morell's dominance. These attempts led to Hasselbach also being dismissed from Hitler's service in 1944, as Hitler reacted angrily to what he perceived as a conspiracy of doctors trying to undermine Morell. Hitler's loyalty to Morell and his willingness to dismiss more qualified physicians who questioned Morell's methods demonstrates the dangerous dynamic that can develop when dictators surround themselves with yes-men and enablers, rather than advisors willing to provide unwelcome truths. Several other physicians had lesser roles in Hitler's medical care, or were consultants brought in for specific issues. These included specialists in various fields who were called upon when Hitler suffered from particular problems, dentists who treated his significant dental issues, and various other doctors who interacted with Hitler's medical care at different points. However, Morell remained dominant throughout most of Hitler's time in power, and it is Morell's treatments and their consequences that have received the most historical and medical attention. As the war reached its final stages in early 1945 and Hitler moved into the Führer bunker in Berlin, Morell remained with him, continuing to provide his injections and medications. Hitler's physical condition during these final months was clearly deteriorating, with severe tremors, particularly on his left side, a bent and shuffling walk, facial tics, mood swings between brief manic energy and deep depression, and general physical weakness. Much of this deterioration was likely due to the combination of stress, age, possible Parkinson's disease, and the effects of Morell's dubious medications, particularly long-term use of stimulants and other drugs. In April 1945, as the military situation became completely hopeless and as Hitler prepared for his suicide, Morell was finally dismissed. Different accounts give different reasons, with some suggesting Hitler himself decided he no longer needed Morell's services as he prepared to die, while others suggest that those around Hitler finally convinced him to send Morell away. Morell left the bunker in mid-April, and Hitler's final days were attended by other medical personnel, including Dr. Ludwig Stumpfegger, an SS doctor who was present in the bunker during the final days and who died shortly after Hitler's suicide, either killed in fighting or committing suicide himself. When Germany surrendered in May 1945, Dr. Theodor Morell was in Bavaria, where he had gone after leaving Berlin. He was captured by American forces in mid-May 1945. The Americans were very interested in interrogating him because of his intimate knowledge of Hitler's health and his daily access to the Führer over many years. Morell was taken to various interrogation facilities where he was extensively questioned by American intelligence officers and by medical personnel who wanted to understand Hitler's health, the treatments he had received, and any information Morell could provide about Hitler's mental and physical state. particularly during the final years. Morell was also investigated regarding his business dealings and potential financial crimes, as he had profited extensively from his position. The interrogations of Morell revealed the extent of his questionable medical practices and the shocking array of substances he had been giving Hitler. American medical officers who reviewed his treatment protocols were appalled by what they found, describing Morell's approach as quackery and as potentially contributing to Hitler's decline. However, determining exact causal relationships between Morell's treatments and specific aspects of Hitler's condition was difficult, as Hitler suffered from multiple health problems whose origins were unclear, and as Morell's poor record-keeping made it hard to establish precisely what he had been administering and in what quantities. Morell himself defended his treatments, insisting they had been effective and necessary, and showed no understanding that his approaches had been medically unsound or harmful. He portrayed himself as a loyal doctor who had served his patient to the best of his ability, deflecting any suggestion that he had been a charlatan or that his treatments had damaged Hitler's health. The question of whether to prosecute Morell as a war criminal was considered but ultimately was resolved negatively. Morell had not been involved in the medical experiments on concentration camp prisoners, had not participated in the euthanasia program, and had not committed the types of medical war crimes that led to prosecution of other Nazi doctors. His crimes, if they could be called that, were malpractice and medical quackery, practiced on a willing patient who insisted on receiving his treatments. Poisoning Hitler with dubious medications was not a war crime, particularly as Hitler had demanded the treatments and had rejected conventional medical advice. Moreover, by the time of his capture, Morell was in very poor health himself. He suffered from various ailments and was obese, and he declined rapidly during his captivity. American authorities concluded that Morell was not a significant enough figure to warrant war crimes prosecution, and that his poor health made prolonged detention and trial impractical. Morell was released from American custody in 1947, having spent about 2 years in detention and interrogation. He was classified in denazification proceedings as a follower rather than a major offender, receiving a relatively mild judgment given his prominent position, likely because his role had been as Hitler's doctor rather than as a policymaker or perpetrator of atrocities. After his release, Morell attempted to return to medical practice, but his health was failing and his reputation had been destroyed by revelations about his treatments of Hitler. He lived in reduced circumstances, supported partly by family, and struggled with various health problems. He died on May 26, 1948, just over a year after his release from custody, at age 61. His death was not widely noted, and he left little legacy beyond his notorious role as Hitler's doctor, and the historical questions about how much his treatments contributed to Hitler's decline. Doctor. Karl Brandt's fate was very different and far more severe. Unlike Morell, whose crimes were limited to malpractice on a willing patient, Brandt was deeply involved in the Nazi euthanasia program and in criminal medical experiments. After his dismissal from Hitler's service in 1944, Brandt continued working in various medical administrative roles in the Nazi system. He was captured by Allied forces after the war and was identified as a major war criminal. Brandt was tried at the doctor's trial, one of the Nuremberg subsequent proceedings that focused specifically on medical personnel, who had committed war crimes. The trial, which ran from December 1946 to August 1947, examined the involvement of Nazi doctors in euthanasia, in medical experiments on concentration camp prisoners, and in other medical crimes. The evidence against Karl Brandt was extensive and damning. He had been deeply involved in the T4 euthanasia program, which murdered approximately 70,000 disabled and mentally ill people between 1939 and 1941, and in the continued killings of such patients after the official program ended. He had held administrative authority over medical experiments conducted on concentration camp prisoners, including experiments involving exposure to extreme cold and altitude, infection with diseases, testing of vaccines, and various other tortures disguised as medical research. Brandt's defense was that he had been following orders, that the experiments had scientific and military justification, and that he had been serving Germany's interests as he understood them. The tribunal rejected these arguments, finding that Brandt had voluntarily participated in and facilitated war crimes and crimes against humanity. He was convicted on multiple counts and was sentenced to death. Karl Brandt was hanged on June 2, 1948, at Landsberg Prison, one of 7 defendants from the doctor's trial, who received and had carried out the death sentence. His execution represented justice for his extensive medical crimes, though it could not undo the suffering he had caused or bring back his victims. Dr. Hans-Karl von Hasselbach's fate was less severe than Brandt's, but more consequential than Morell's. Hasselbach was captured at the end of the war and was interrogated about his knowledge of Hitler and his involvement with the regime. While Hasselbach had been an SS officer and had been part of Hitler's medical entourage, there was not sufficient evidence that he had been directly involved in medical war crimes at the level that would warrant prosecution. He underwent denazification proceedings and was classified as a lesser offender, facing penalties including fines and temporary restrictions on practicing medicine, but avoiding imprisonment or execution. Hasselbach was able to resume medical practice after a period of prohibition, and he lived until 1981, dying at age 73. He gave occasional interviews to historians about Hitler's health and the medical dynamics in Hitler's entourage, providing testimony that has been used by scholars studying Hitler's decline. However, Hasselbach was not particularly forthcoming or self-critical about his own role and his membership in the SS, generally presenting himself as a medical professional who had been caught up in events rather than as an active participant in a criminal regime. Other physicians who had treated Hitler or who had been part of his medical entourage had varied fates depending on their individual circumstances and the evidence of their activities. Dr. Erwin Giesing, an ear, nose, and throat specialist who treated Hitler in 1944 after he was injured in the July 20th assassination attempt, was captured and interrogated, but was not prosecuted. He provided detailed testimony about Hitler's health and about the conflicts between Morell and other doctors. He was eventually released and returned to medical practice. Dr. Ludwig Stumpfegger, who had been present in the bunker during the final days, died during the attempted breakout from the bunker area on May 2, 1945, either killed in fighting with Soviet forces or committing suicide, avoiding capture and any post-war accountability. The broader category of Nazi doctors, beyond just those who treated Hitler personally, faced varied fates after the war. Some were prosecuted at the doctor's trial and other proceedings. with 16 defendants at the main doctor's trial receiving sentences ranging from death to acquittal. 7 were executed, 5 received life sentences, 4 received long prison terms, and 7 were acquitted. These prosecutions established important principles about medical ethics and the prohibition against using human subjects in experiments without consent, principles that were codified in the Nuremberg Code that emerged from the trial. However, many Nazi doctors who had been involved in criminal medical activities were never prosecuted, either because evidence was insufficient, because they were in areas occupied by the Soviets where different standards applied, or because they successfully hid their activities. Some Nazi doctors resumed medical careers in post-war Germany, a troubling reality that reflected the imperfect nature of post-war justice and denazification. The question of medical ethics and the physicians who treated Hitler raises profound issues that extend beyond their specific fates. At what point does a physician's duty to a patient conflict with broader ethical obligations, particularly when the patient is a dictator whose continued health enables crimes and suffering? Was Morell's malpractice on Hitler actually a service to humanity by degrading Hitler's health and judgment? Or was it a crime of keeping him functional longer than he otherwise might have been? Should physicians who enabled Hitler through medical treatment, even if that treatment was incompetent, be held accountable for supporting his regime? These questions don't have simple answers, but they illuminate the complex relationship between medical ethics, political responsibility, and individual accountability. Morell's case is particularly interesting because his medical incompetence may actually have done more harm to Hitler than good, yet he faced no legal consequences beyond detention and interrogation. If Morell had been a competent physician providing appropriate evidence-based care, he might have improved Hitler's health and potentially extended his effective functioning, which would have served the Nazi regime. Instead, his quackery likely worsened Hitler's health, contributed to his tremors and other symptoms, and may have affected his judgment and decision-making in ways that hindered the German war effort. There is dark irony in the fact that Hitler's trust in a medical charlatan, rather than in qualified physicians, may have been one of the many ways that the Nazi regime's corrupt and irrational nature contributed to its own defeat. Yet Morell escaped serious punishment, dying a free man just 3 years after the war's end. His greatest legacy being a cautionary tale about the dangers of medical quackery and the corrupting influence of power on medical practice. Karl Brandt's execution provided a measure of justice, but it came only after he had participated in crimes that killed thousands and caused immeasurable suffering. His case demonstrated that physicians can be war criminals just like military commanders or political leaders when they use their medical knowledge and authority to commit or facilitate atrocities. The doctor's trial and Brandt's execution sent important messages about medical accountability, though the messages were not heard or heeded by all, as medical ethics violations have continued in various contexts since World War II. The testimonies provided by Hitler's doctors during their interrogations, and in some cases in later interviews, have been valuable historical sources for understanding Hitler's health and decline, though they must be evaluated critically given the doctors' biases and their need to present themselves favorably. The question of what exactly was wrong with Hitler medically has been debated by historians and medical professionals, with various theories proposed including Parkinson's disease, temporal lobe epilepsy, syphilis, various gastrointestinal disorders, and iatrogenic conditions caused by Morell's medications. The consensus based on available evidence is that Hitler probably suffered from multiple conditions, including a neurological disorder causing his tremors, chronic gastrointestinal problems, and drug dependencies caused or worsened by Morell's treatments. His mental state, whether it reflected underlying psychiatric disorders or was primarily a product of his personality and ideology, remains debated, though most historians emphasize that Hitler was not insane in any clinical sense, but rather was an evil man who held monstrous beliefs and who acted on them rationally from the perspective of his twisted worldview. The story of Hitler's doctors also illuminates the broader question of how professionals in various fields become complicit in dictatorial and criminal regimes. Morell was motivated primarily by greed, ambition, and the desire for prestige and access to power. He was willing to provide whatever treatments would maintain Hitler's confidence, regardless of medical soundness. Brandt was motivated by ideological commitment to Nazism and by the belief that medical knowledge could and should be used to advance Nazi racial goals, regardless of ethical constraints. Other doctors in Hitler's entourage were motivated by various combinations of careerism, opportunism, fear of refusing assignments, and genuine belief in the regime. Understanding these motivations helps illuminate how regimes recruit and retain professional supporters, and how ethical standards can be eroded or abandoned in service of power and ideology. The contrast between Morell's escape from serious punishment and Brandt's execution also reflects different categories of culpability and the challenges of achieving justice after massive state crimes. Brandt committed clear war crimes by any standard, participating in programs that murdered the helpless and in experiments that tortured prisoners. His prosecution and execution were legally and morally justified. Morell's case was murkier because his malpractice was practiced on a willing and indeed insistent patient, because the harm he caused was primarily to Hitler himself, and because incompetence and quackery, while reprehensible, are not war crimes. The decision not to prosecute Morell was pragmatic and probably legally correct, but it left a sense of incomplete accountability for someone who had enabled Hitler and enriched himself through his position. This reflects the broader challenge that not all who were complicit in Nazi crimes could be prosecuted, either because their specific actions didn't meet legal standards for criminality, or because prosecuting everyone involved would have been impractical. The result was that some who deserved punishment escaped it, while the focus was on those whose crimes were most clear and most serious. In conclusion, what happened to Hitler's personal doctors after World War II varied significantly, depending on the individual and their actions. Dr. Theodor Morell, Hitler's primary physician from 1936 to 1945, who treated him with a dangerous cocktail of medications, including stimulants and numerous dubious preparations, was captured by American forces, interrogated extensively, held for about 2 years, then released and classified as a minor offender in denazification proceedings. He attempted to resume medical practice but was in failing health and died in 1948, just 3 years after the war, escaping any serious punishment for his medical malpractice on Hitler and his profiteering from his position. Dr. Karl Brandt, who had been Hitler's escort physician and who became deeply involved in the Nazi euthanasia program, and medical experiments on concentration camp prisoners, was tried at the doctor's trial, convicted of war crimes and crimes against humanity, and was executed by hanging in 1948, receiving appropriate punishment for his extensive medical crimes. Dr. Hans-Karl von Hasselbach, another escort physician, was captured, underwent denazification, was classified as a lesser offender, and was eventually able to resume medical practice, living until 1981 with limited accountability for his SS membership and his service to Hitler. Other doctors had varied fates, with most avoiding serious punishment, unless they had been involved in medical war crimes beyond simply treating Hitler. The story of Hitler's doctors reveals much about medical ethics and their violation, about how professionals become complicit in criminal regimes, about the challenges of achieving accountability after massive state crimes, and about the particular dangers when dictators surround themselves with enablers and yes-men rather than professionals willing to provide unwelcome truths. The fates of these physicians ranged from execution to comfortable post-war lives, reflecting both the achievements and the limitations of post-war justice and the complex questions about responsibility and complicity that continue to challenge our understanding of the Nazi period.